And I do love to cook. We love to eat.
Or bacon fat.
Tobacco.
Smoking does add to that, yes. Yeah, but yeah, seasoning with bacon. Again, that's one of those things you just might as well take it and apply it right there, because that's where it's gonna go. $700,000 per year. Half have some sort of permanent disability. Economic impact.
Is that the United States or?
Yeah, yeah, this is just United States data. So, ooh, we need someone bad too. I think you know who we go with. Maybe she'll bring some more cookies.
Please.
We're talking about. Okay, what is a CVA? It's a sudden loss of blood supply to the brain. And we're gonna talk here in just a second about, there's actually two types you can have. You can also have a TIA, which is a temporary, you have symptoms like having a stroke, but it's only gonna last, or it should clear up within 24 hours. Some people will have, if you have a TIA, a third of those will have another TIA, a third will move to a CVA, and a third will have no difficulty. It has been my experience though, a lot of times when they talk about people having mini strokes, that's just a red flag that the big one is coming. Okay. And here are two types. You got an ischemic CVA, and you have a hemorrhagic. Now, ischemic is a blood clot, okay? A thrombus is just a blood clot, an embolus is a traveling blood clot. So you could have a blood clot in your leg, let's say, that travels to your brain and causes a stroke. That would be an embolus. A thrombus is just a clot that is formed because the artery has been occluded, yes, okay? Looks like so. It shuts off the blood, okay? So this area is without blood supply, and you don't get any good oxygen there, and the tissue will die. The other type is a hemorrhagic. This is what Beth said that she had. A lot of times they're caused by arteriovenous malformations, okay? Which a lot of times they're diagnosed when they blow, okay? An AVM it's a 25-cent term for there's a weakness in the vessel, okay? It's an aneurysm, all right? But a lot of times you don't know you have one until symptoms appear. All right, 20% of all strokes are hemorrhagic. There is a higher incidence of death, and there's usually more damage caused by a hemorrhagic stroke, okay? Here's why. We do have that blood-brain barrier. Anybody remember that? What happens when the blood touches brain tissue? It does not, all right, and it kills it. So we're looking at a much larger area that's being impacted.
So it's worse to have blood on the brain than it is for the brain tissue to not get any blood?
Yep.
The blood on the brain. I wouldn't know.
Well, it brings with you phagocytic, a situation where it starts to eat and damage the brain tissue. It's gonna destroy it, it's just gonna totally,
Now,
it's gonna go after what it's there.
yes,
Supposed to.
yes, and think for just a moment, we'll talk more about this with TBIs, but what's going to happen when you've got blood coming into an enclosed space?
Swells, and you got edema and swelling.
And it can't go anywhere.
Right.
So not only is the blood killing it, but the increased pressure pushing it up against other bony parts, or that's also gonna cause damage.
Could you do a spinal tap and see, instead of it being a clear watery liquid, then it becomes cloudy? I mean, if you were to do something like that?
They can do that, but most often, they'll do a CT.
Right.
So, it is important for us to know whether it's an ischemic stroke or a hemorrhagic stroke.
I think we treat them quite differently.
You do. Oh, and here's something you might wanna look at. Okay, risk factors. Oh, bless you for whoever started that. What are some things that cause CDS? These are the things that we can't fix. Okay? Age, gender, a race, and your genetic predisposition. So, Kitty, I think you asked me a while back is if I eat good and exercise and do all this stuff, will that prevent it? It might slow it down. But because of these things, those are things I can't fix. So if you have a family history of having CVAs and high cholesterol, watching your diet, doing exercise, all that stuff may slow it down or it may not. Okay? But here are the things I can work on. What's that? High blood pressure, cardiac disease, diabetes, obesity, diet, high cholesterol, use of oral contraceptives, cigarette smoking, and alcohol abuse. I'm not gonna ask for a show of hands. Okay, but how many, look at all those things. Now, again, here we are in South Carolina. Let's go back to our seasoning with bacon grease. Okay? How many things? We go here, we go here, we go here. Oh, we could add to that. Is this dropping off any?
It's like turning into, yeah, vaping or like cigarettes, but it's just like a high content of nicotine. It's still probably not good for the body. It's just replacing the tar with nicotine.
People think vaping is safe, like people blow it
Yeah,
It's just not a good idea.
it's still, you're still putting a toxic substance in your body.
I think the results of vaping will come about much more quickly than smoking,
Yes.
according to
But
the
it's
Harvard
disturbing
study.
because right now people don't realize it. They think it's, that they don't need to wash their, like, if you see someone with a cigarette, most people know that, like, you don't smoke around kids and stuff, but people who vape just don't care. They don't realize that. And, like, I've had people sit right next to my child and, like, blow out the smoke from that.
Did they live?
Apparently, and I don't talk often, but that was one
There were too
time.
many witnesses, so yes.
That's what,
Yeah.
is a congenital heart disease still categorized as a cardiac disease? Those two different things.
I think a congenital heart defect.
Yeah, like a defect.
If it's a
Is
defect
that-
that's fixed, then that's not a disease, right?
Okay, something that's hard too. So it's like acquired.
And you also gotta remember this stuff is cumulative. Okay? Granted, smoking, if you smoke for 20 years and then you quit, that's great. But you still haven't smoked for 20 years, right? You have something to add to that?
I was just gonna say also about the cholesterol. For several years, I'm like doing all I can to be all healthy and stuff, and my doctor's like, you're over 200 of cholesterol, genetic thing. My HDLs are HDLs are canceling it out.
Right.
But I had no idea, and I go back to my mom, and she pulls her file up, she's like, I know, and then she's like, I have to watch mine too. But it was the cholesterol that is crazy in my family.
It can be very genetic.
Yeah, and if you're not canceling with the HDLs, then you're at risk.
Yes, yes.
Even though you're doing everything, exercise, you're not
Right,
doing bad.
right, that's what, yeah, there's some things that, this stuff we can't fix.
Mm-mm.
This stuff we can't fix.
And if friends of mine, they're, doing all the bad things, eating ice cream and stuff, and their cholesterol's fine. I'm like, no!
I know.
That's
My
not
husband husband's like that, everything has to be fried. Everything. His cholesterol's way lower than mine. I'm like,
fair.
That makes me mad.
yes, I'm like, I'm working really hard here, and you just,
well.
It's really amazing, like, so, my mom is, she's one of 7 children, 5 daughters. 3 of the 5 daughters have all had, TIAs. My mother had a stroke in her optic nerve.
wow.
It's related to her diabetes.
Uh-huh.
She's been uncontrolled forever. And then the other 2 women, very much like, one of them is super health nut, 20 years younger than the other 2. And she just had one last year. And the one that's right below my mom's age, she just had one last year also. And they discovered that there's a mixed tissue, like connective tissue disorder. So it's probably that but my mom's health is so terrible, it's like she's just begging for it.
Yeah.
But the 3 have very different lifestyles, and it didn't matter. They each, it's basically like a race, like, let's outthink each other.
Yeah.
So it's kind of one of those things where it's like, well, I mean, shoot, if you know what's coming down the pipe, are you going to, right, so it's just kind of interesting to hear them talk amongst themselves about it, because, I mean, their lifestyles have been so different, and the healthiest, youngest one still got hit. And so, it's pretty interesting. I mean, they're all fine,
Well, but,
Whatever.
let's go back and think for a minute. How do we as adults learn? We've already learned that scare tactics don't work.
they do not.
And then I'm going,
Well, they say that when you're younger and have them, then, you're better off, right? So if I have it younger,
if I'm gonna have it anyway.
yeah, might as well be younger.
So what you're really asking is, how do you get someone to buy into the
Ah,
healthy
there we
way
go.
of living, diet and exercise, but embracing just a more healthy way of living at all, across the board, in every aspect of your life,
Because where does the change come from?
Intrinsic.
within the person. Gotta want to.
I told you I'm not proud of this, but actually smoking is a way to get someone to do something for me. It was like his 3rd or 4th stroke. He didn't slow down.
Like, ask them to do something and you give them 1 cigarette.
I had to bribe him.
Bribe.
Your prize for prize.
Well, yeah, that's exactly what it was. Cause I had to do his ADLs and he would always get, and I would tell him, I'm gonna be here at 7:15. You wait for me. I get there at 7 o'clock and he's already done it. Okay, so he was deliberately outrunning me. So I finally had to go, tell you what, I've got to see this, cause I gotta make a recommendation on where you're going. If you wait for me, then I'll take you for a smoke break. He's like, okay. Again, not proud of that, not recommending that.
But you weren't trying to cure him, you were trying to like.
The smoking cessation was not part of your.
It was not on my goal list, you are correct, so. All right, what are warning signs?
There's none that is.
Acronym for it.
We're, hold on to it, we're getting to that. I think it's the next one, or it's
Yeah.
somewhere in there.
But it works for every
Sudden numbness on the face or arm, trouble seeing, confusion. And I'm not talking about the type of confusion you feel here at about 11 o'clock. Okay. I had a friend, actually, gosh. She was in her 20s when this happened to her. She'd have a lung condition that she was having to take, steroids for. It's just a chronic thing that she has to take steroids for, and she was telling me she was in the church choir. She was holding her hymnal, and they were singing, and then all of a sudden she looked down and she had no idea what those marks on the paper were. talking, again, not talking about it in class. Severe headache. Fast. Somebody complains of dizziness or complains of weakness, numbness, ask them to smile
Right.
and look for what? Symmetry. Can you hold both arms up? Are they symmetrical? What's their speech sound like? And I need to hurry and call 911. Because I am on a clock. This is a cool thing. TPA is a clot buster. Okay? But I've only got 4.5 hours from onset of symptoms to get in and get it. Now, what has to happen in that 4.5 hours? I have to recognize I'm having a stroke or potentially having a stroke. Okay, most of us, you're not weird like me. I wake up with it like having slept on my arm wrong and convinced myself I've had a stroke. I just know that's what happened. Tiki, do you do the same? You start feeling your leg and stuff.
Heart attack because you slept on this side.
Yeah, that's exactly it. So I have to recognize that I'm having a stroke. Most of the time, you feel a little dizzy, a little weakness. What do we tend to do? Let me sit down and rest a minute. Okay? But I've only got 4.5 hours to get to the TPA. Okay? TPA is a clot buster. So I need to know if it's a hemorrhagic stroke or an ischemic stroke. Because if it's a clot buster, what does it do? Thins the blood. If I am having a hemorrhagic stroke,
No.
I don't want this.
No.
So, how do I determine that? You have to have an MRI or a CT. Anybody tried to get one of those lately?
So like with Beth McKelvey,
Yeah.
they couldn't do anything until you can't really administer something en route to the hospital? Wow.
So it's
Because you could kill it.
Wow.
So ischemic, you don't want the blood.
No, ischemic you do.
You do. Okay.
Hemorrhagic you do not. So, I got to get to the ER. I have to be bad enough for them to recognize that there's something they need to address now. I need to have somebody who's got, oh, I was about to be real ugly and I'm not going to. I need to have a physician who recognizes signs and symptoms and who can get me into CT as quick as they can, get it read, and get the drug administered within 4.5 hours.
I can personally share that it actually goes pretty quickly. When I first got sick, they thought I was having a stroke.
Really?
And so when I showed up at the ER, they were ready to go. They
Good.
put, everything in my veins and had me going, test after test after test. I mean, they didn't stop until they were sure that, okay, you're not having a stroke. So,
Good for
I
the
mean,
heads
but
up.
they do, they kind of, if you go in and that's what's happening, like, they're fast, or at least in Georgia when I was there, so.
Which is cool that because you don't typically fit the profile of someone having a CVA.
Right, well, and that was it. I mean, I was 25 and couldn't feel my face and could barely speak, and they were like, this one's going down.
Yeah.
You
Yeah.
know, like, it was pretty, shocking to everybody, so.
I'm glad seriously, I'm glad that they picked up on that.
Oh, yeah, it was really good. I mean, I'd been dealing with it for, I don't know, 2 or 3 days. I was really not with it until someone caught on that, hey,
Ooh, yeah.
you're not making sense on the phone and we haven't heard from you.
Okay.
Yeah, but they were fast.
TPA is good stuff. I've seen 2 or 3 people, or actually I've seen several people who've been administered the TPA. There's no residual. But again, I got time window to hit up. Okay. It does work very nicely, but I got to get in there and get that CT done. Because if it's a hemorrhagic stroke, I don't want that. Okay. So what do we do? Okay, if we don't have an airway, what's the point of doing this? Okay,
Does that happen often?
depends on how bad it is or where it is. So, make sure that we can exchange oxygen and CO2, so that's gonna be our, you will not be the first person, unless it happens like out in a restaurant or something like that, you're not gonna be the first person to see this, but they're going to maintain an airway, get an airway, they're going to check fluid balance. I don't know nothing about that, neither do you, but some of you know. But, not our job, but we've got to make sure that they're getting enough, not too much. Okay, so somebody be taking care of that. If the heart's not working. Yeah, where is it? What's a DVT?
Deep vein thrombosis.
And what do we need to be careful of?
Been sitting still for a long time.
The embolus could move.
Yes, it becomes a deep vein thrombosis. It can become an embolus,
Right.
and an embolus can travel. If it goes to your lungs and it's big enough, you go on to glory. That's all they can do for you. You better have your affairs in order on some of those. In fact, the two patients that passed away while I was working with them, they both were PEs. Yep.
Why are you guys working with them?
Yep.
So what can be done about that?
Well, this is why you go into your client's room and you, how are you feeling? My leg's hurting. Ooh. In your head, you should hear ding, ding, ding. Okay? Go look at it. Can you show me which one? If it's red, hot, swollen, you go, you know what? We're gonna have a nurse come look at this. And I am not getting you out of bed. This is what those sexy white stockings are for.
The Ted hose.
Yes. These are what those SCDs are for, to prevent this. Okay? Getting up and getting moving, that's what that's for. Okay? And then sometimes it just happens. The one guy that I was working with, he was supposed to go to rehab that afternoon, so he'd been up. He'd had his stock, we'd done everything. He just threw a clot. Okay? So, when your patients are like, my leg hurts, or you're doing their ADLs and you're helping them and you look at that leg and that calf is red and swollen, and you just go get nursing to look at that and have them take care of it and say, here, this is yours. Okay, until they come up and run a Doppler on it, you don't get them out of bed. You get someone to say, it's okay to get them out of bed. Okay? And then they'll put them on blood thinner sometimes, which does what? And what does it do to the rest of us? What'd you say? Bruise. And if you break the skin, yes. Okay, now, let's think for a minute. If this particular person had a hemorrhagic stroke, then they get the DVT on top of it, we're about to have a mess. Okay? Subluxation, what's that? If I get to see that while they were out? How bad were they subluxed, could you tell?
Oh yeah, because you could just look at them and like, you knew that was what it was. His shoulder, like if his shoulder was here, and
So you can put it under the acromion there, and you can, there's either a full finger or a partial finger, sometimes there's two. Okay? Again, what is holding your humerus to your body? Okay? Muscles and ligaments, right? What happens when those muscles, tendons, and ligaments are not innervated? It is now an unopposed force of 20 pounds pulling it, right? Why 20 pounds? Average arm weight and gravity, right? Roughly 20 pounds, all the time. So if it is not positioned in a position to where it is being supported, what is going to happen? Still an unopposed force, right? Okay? So, if and when I start to get motion back, I have now lost my mechanical advantage, and I've got to overcome that as well as work on strengthening and getting function back in that side. But everything that I'm supposed to be using on that side has now been overstretched. Make sense? It can be very, very painful. Sometimes not, because this sensory stuff is messed up with the stroke. Bowel and bladder incontinence. Having a CVA is not bad enough. Now you gotta have someone take you to the bathroom. If you are aware when you need to go. Okay, along with that, was this thing called skin breakdown? Sure. What else is gonna cause skin breakdown?
Pressure source.
Yep, because what?
The cubitus system.
I'm not moving,
Yeah.
or at least half my body's not moving.
And you have to rely on somebody else to run you every 2 hours.
Right.
Very good. And how often does that happen? We would like to say,
Every 2 hours.
it's right every 2 hours. We would like to say that.
No, it doesn't.
The reality is, stuff happens and, yeah, I don't let them refuse on that.
No.
Don't what?
I said, I don't, she said, our patient refuses, I said, I don't let them refuse on that. And technically, yes, that's breaking the patient, bill of rights, but
You're trying to.
you get a benefit now, so. And how do we not get sensory breakdown, skin breakdown, I just told you. How do we not get skin breakdown? Right, so if you got sensory problems, motor problems, cognitive problems, plus bowel and bladder incontinence. You're shaking your head about it. See it all the time. Yeah. An aspiration is what? When you swallow, stuff doesn't go down the right pipe, or all of it may not. Which can lead to pneumonia. And not everyone coughs when they get checked, when they aspirate. Remember watching that video, that stuff just poured down in that guy's lungs?
That was painful.
Isn't it? Some people are like that. And you'll have, here's the fun stuff. Spit is what? What consistency? It's a thin liquid. So if I got a patient who I say, we've done the videos on, and we say, okay, no thin liquids,
You can't make them not spit.
I've still gotta run, I'm running the risk of aspiration pneumonia. Huh? Yeah. Recovery, generally generally spontaneous during the first 3 months and can continue up to the first year. Are the things we do helping? Yes. They are a benefit. But I can't control how fast or how far. Does that make sense? I can facilitate all day long. So what affects recovery? Age, how bad it was to start with, because yes, you can go into a coma state. This is your biggest indicator of recovery. Is loss of perceptual skills. If they have a large loss of perceptual skills, the potential for recovery is much lower. Lack of sensation. Prior history. All that makes sense? Thank you. Good time.
I don't know, I'm not a good judge.
Anybody else need to go?
See?
Go if you need to. Okay. So what do we wanna do? Improve motor function on the weaker side. Okay. Working on balance, symmetry, and writing reactions. What do you wanna do with your CP kids? Improve motor function on the weaker side. Balance, symmetry, and writing reactions.
Same thing. Well, they're both brain injuries.
Neuro's neuro. I want to integrate my cognitive, visual, perceptual, and sensory functions. Or I want to be able to be aware of those and the loss thereof, and what can I do to compensate for. My big, big, big goal is functional independence in the least restrictive environment. What does that mean?
Depends on how serious their loss is. Their environment may be a skilled care, or it may be assisted living, or maybe you can get them back to living by themselves.
That really is the goal for everybody. You're absolutely right, it's gonna depend on all kinds of things. But my overall big goal is I want them to be as functionally independent as possible in the least restrictive environment.
This goes back to our segment, for our client who had that stroke. And we've got to teach her, get her back to be able to cut that circle, so she can return to whatever life role she had. Same thing for her.
Yeah. I mean, it really, that's,
Right.
yeah, that's our goal for everybody,
Right.
and to be able to return to life roles. Any questions so far? She didn't necessarily have one.
Oh, okay.
They chose for her to have one.
We
You
made
didn't have to
that.
choose for that.
Yeah. You should see what happened.
Just panic in the streets right there.
Sorry. But it was ischemic, I think, towards its hemorrhagic.
That didn't fall down. Fall down was
So what might I see? Good. Good. And anywhere in between.
Can you give another example of abnormal reflexes? I think you mentioned something last time about, like a head going one way and walking a certain way.
Oh, yeah.
You said, oh, this is so fun.
So now,
Party
what
trick.
type of reflexes might we see? Junior class, because the seniors are having to dust this off. What? Deep tendon's one, and we'll talk, those are different than primitive. What primitive reflexes? ATNR, what else? STNR? What? Yes, all those may resurface. Line. Right, those are hard coded, right? Those are what have been given to us as movement patterns. And there are foundational ways of learning how things move. Name. If they were, if you have somebody who was a premium, they never developed, you eventually, that's a whole different thing. But these may reappear because the area, the stuff that we learned on top of that is either temporarily or permanently gone. Okay. So, this is like, what is our flexor pattern? Don't use the words, just show me. Okay, all right. So, if I have someone who's in a flexor pattern, one of the things that I can do is have them look to that side, because what am I trying to tap into? ATNR, because if I look to that side and ATNR has come closer to the surface, it's gonna decrease tone, and I can pull them out into extension. Now, I'm not saying they're gonna shoot out, okay, but it may decrease it enough that you can get it out. Okay? I may also ask them to look at the ceiling while I'm doing that, because that does what? STNR, because STNR does what? Right. It's the kitty cat one.
Right.
You know, they drink milk, they flex their head, what happens to their front feet? They flex, and then their back ones extend. When they sit up, pull their head up, what happens? They extend here, and flex here. Okay, I can't tell if it's A, Monday, B, if any of these boxes are open, or if they're connecting at all. And let me just add, and it's hot as you know what in here. We getting it? Okay. All right. I may not be able to sit up again. Again, okay guys, keep in mind, where is my perspective? Mine is coming from, I worked in acute care, so I saw these people. They came in at 7 o'clock, I was seeing them 11 o'clock. Okay? Baby, I had a stroke. Yes ma'am, I know, that's why I'm here. I don't need to get out of bed. Your doctor disagrees with that because he asked me to come see you. Okay? So I was starting sometimes with people who couldn't roll, who couldn't come from supine to sit, let alone sit. So we had to work on developing these things. And what are these things again?
Writing has to do with the head.
Midline orientation. Postural control, even if they're not as, not as bad as being so low level, I can guarantee you all saw people sitting in a chair like this.
Mr. So-and-so, you're waiting, sit back up. It was so helpful.
Yes. Yes. Because that, yes.
So he either can't sit back up or he doesn't know, it could be both,
Wait,
either one.
yes, yes.
Sure, it sure looks wonderful.
But now think about yourself. As class goes on, what happens to our posture?
Getting real bad.
And then you're gonna start with Lord, is she ever gonna finish? You can't even hold your head up, right? Okay, so we keep, same thing happening with these guys. I can sit them on a mat and we can sit up, okay, and we can work on that, and I put them in a chair and they get tired. And my favorite is when we go to the dining room.
They're halfway into their food.
Yeah, you're like, okay, if anything gets in, it's going in the wrong place, okay? So I need to help them learn how to take visual cueing to be able to work on my posture. I need to learn what it feels like. We're just redeveloping these things that were there, okay? And for whatever reason, stroke, TBI, CP, whatever, well, CP, it never was there. You're building those skills, but with a stroke or with a TBI, it was there, and I'm gonna have to go dig it out or redevelop it. Okay? Abnormal muscle tone. Ah, we just talked about that. What's that?
Too much readiness or too little readiness, you don't focus.
Right. Either way, you can't move well, okay, because it's either you're floppy, okay, or you got too much tone in your. So, in our upper extremity, we tend to develop a what kind of synergy pattern? Which looks like. And what does an extensor pattern look like?
Depends on which
And
one.
then you die. Okay, if you're just doing it in the arm, what does it look like in the arm? All right, hello, now you've already studied for part of your test because you've got the answer right here.
And so when people are in there going,
Doesn't bother me at all. In fact, that means we're thinking. Okay? So, which muscles are, not everybody will go back to flaccid. Depends on where the injury is and how big it is. Okay? And again, not everyone, you will not see these on everybody. What you're probably guaranteed to see is one-sided weakness and some cognitive perceptual stuff. Okay? Depending on where the insult is and how large the insult is will depend on the continuum of stuff that you see here. Yes?
Excuse me, when we're really little, like we crawl first, why don't, this sounds, coming out of my mouth, this sounds silly, but why don't we teach them to crawl? Like, why isn't that a skill?
What, crawling?
Yeah.
Some kids do it. Oh, with adults?
Yeah. I mean,
Okay, you certainly can do that, but there's usually two things that'll stop you.
Arthritis.
Room,
okay,
okay, and it's gonna take about 4 people to do that.
okay.
And that's usually if you are frisky enough to do it, I think it's a great thing, cause that's a lot of good weight bearing and, proprioceptive input and eye-hand coordination, that's great stuff. But putting an 8-month-old versus putting me.
And then, a lot of times they don't even have like the strength to hold themselves up because they are so weak.
Yes.
Is that's why it takes 4 people.
Well, and again, getting an adult out of the floor. Julie's laughing. Yeah. Yep, if you've never tried that, you'll get to one day.
Well, it's a dignity thing too. I mean, because you don't want to put the 80-year-old going, okay, we're gonna teach you how to crawl.
Right.
You know, I mean,
Because most of us
like
are
you
not
said, it's a
dressed
good
for
idea,
that.
but-
In those real attractive gowns, most of us are not ready for that. All right, yes,
We can save it for after break.
no, go ahead.
I was just gonna say, like, I know with NUT we discuss spastic movements, with patients in CDAs, are we going to see the same disorders with that muscle tone, like spastic,
where the injury is, depending on how bad the injury is. All this stuff we're talking about is on a continuum. Okay, you may have some people who are just hemiparetic, which means they've got motion everywhere, but they're weak. Okay, if they have paresis, okay, that means there's not motion. So you've got from no motion to weakness. They may have full motion, it's just weak. Okay?
So we won't really see any spastic behavior.
Yeah.
You will.
You will.
Okay.
And that's what I'm saying, everywhere in between. You may see completely flaccid to ones that are pulled right up into, okay? It's just, and that's the cool thing and the not cool thing. Because we're all individual and we're all wired a little differently. You know, some people there'll be people that you go, ain't nothing coming back out of that, okay? And then they come in 6 months later walking and talking. And then there'll be those who theoretically should be doing fine and are doing squat. So that's what I'm saying, all this is on and there's a theory, just so you know, there's been a theory batted around for several years, on if we even need to teach diagnoses, but rather just teach the functional laws. But I think you need to have a background of understanding where you're going, but I get the functional laws part, does it really matter? This is what they can't do. Okay, well, I can follow that too, so.
Okay, so it's just gonna vary. Every
It's gonna
person's very
vary?
different. Okay, I just didn't know okay, I get what you're saying.
Well, I'll tell you what, tomorrow, or whenever we have lab, we're gonna be watching videos of people that have had various CVAs. And we're gonna be talking about it, and we're gonna be looking for all this different stuff, and you'll be able to see,
What a different level. of-
Yeah.
Okay,
yeah.
cool.
It will make a little more sense then.
Okay.
Do you have a question?
No, I want her to ask her a question.
Oh.
You didn't
Okay.
see her, she had her arm up for like 10 minutes.
Oh, I'm sorry.
No,
That's
sorry.
okay,
I
it's not you.
apologize.